Your GI will manage your Crohn's through pregnancy, but almost none of them will sit down with you before you start trying. And that gap, well, it can cost you. Hi, I'm Kate, and today we're talking about Crohn's and fertility, specifically the 5 things your GI should tell you before you start trying to conceive. If you have Crohn's and a baby is on your horizon, this conversation is one you deserve to have now, not after a struggle. The moment fertility came up in our family, it was first raised by a GP. Our GI specialist had never mentioned it. What my husband was never told before his 3rd surgery, and we pieced it together afterwards, is that surgery has a big impact on things happening in your pelvic region. Things get moved, things get pushed around, things may even get damaged in surgery, and nobody mentions that. Now, another patient I had in clinic had been trying to fall pregnant for a year, but no one had checked her ferritin. These things are very important. So here's what I want you to hold on to for this whole video. Having Crohn's doesn't mean you cannot have a healthy pregnancy. The research is actually pretty reassuring. Women with Crohn's in remission have pregnancy outcomes that are close to the general population. The risk goes up when disease is active, when nutrition is depleted, and when nobody has done a preconception review. This isn't about fear, it's about walking into that trying to conceive window with every advantage you can give yourself and your baby. So medication, it's actually pretty safe during pregnancy. They have clear safety data than what patients are being told, and stopping without guidance is often the bigger risk. I had a client who stopped her biologic at home because she assumed it was dangerous, and guess what happened next? She flared. Disease activity timing. Conception during active disease raises the risk of preterm birth and low birth weight. Remission timing is something that you can plan for, so obviously you need to wait for the right conditions. Wait for remission and then begin to try. Also make sure nutritional deficiencies are adequate at inflammation. Iron, folate, B12, zinc, and vitamin D, they're all commonly depleted in Crohn's, and several of them directly affect egg quality, implementation, and even early fetal development. So you need that specific deficiency panel run before you begin to try to have a child, not just a normal GP standard blood test. You need to specifically test those. As I mentioned before, pelvic surgery, including bowel resections and IPAAs, they can significantly reduce fertility through scarring and structural changes, and patients are rarely warned before the operation. Now, I mentioned my husband's 3 surgeries. What we know now about pelvic adhesions, nobody explained that to us at the time. So a dedicated preconception appointment with your GI, not just your next routine review, should cover medications, disease status, nutritional labs, and a written plan for monitoring in the first trimester. I tell my own clients in clinic to actually go to see their GI to get this appointment on the calendar. Do not just use a normal appointment for this. As I've mentioned before, my son, he's in deep remission now, and that means for his future family planning is a conversation that I'll have with him one day, but he's going to be in the best possible position. The shift I see in clients who come in informed versus patients who find out mid-pregnancy, well, preparation changes everything. They're prepared, they have their situation under control, and they know what's going to happen. The realistic, hopeful picture, Crohn's and a healthy baby, well, they're not opposite. Preparation is the bridge between the two. If your GI hasn't offered you this conversation, you're allowed to ask for it, as I said. Make sure you make that appointment. Tell them that you are coming in for a preconception appointment and you would like bloods done specifically, preparation and knowledge about your medications, this, that, the other. So you have everything organized. Now, I'll see you in the next video. Have a beautiful day.